Hello guys, and welcome to this video to talk about recurrent caries, alright? So feel free to pause the video and try to diagnose all these radiographs by yourself, considering of course that you guys don't have clinical information so far, okay? I'm going to tell you that all these cases had pain, so we also need to understand how to investigate the pain, okay? So what would you do, alright? This is the most important thing for us, decision making, okay? So what exactly would we do here? And let's start now, without further ado, by the case on the top left of your screen, okay? So we have a situation here where there are several caries, lesions, okay? I hope you guys are able to diagnose all of them. Most of them are interproximal caries, all right, like this one. Of course, when you have superimpositions, I can still diagnose the caries, but then of course it's a little bit more challenging, and that's why your bitewing radiographs should be parallel to mesial and distal surfaces of the teeth, okay? So always the X-ray source parallel to the interproximal surfaces, okay? That's your horizontal angle, okay? So, but we can see here that this is not even initial anymore, right? I'm talking about the 2.5, so the upper left second premolar, and there is interproximal caries, there is distal caries, okay, even mesial caries, and those are not initial anymore, okay? Now we even have the first premolar with caries as well. I'm not sure if the image is, the contrast is maybe is not the best one, but we can see caries, of course. And then even here, the lower premolar, here we have mesial caries, okay? This is no longer initial as well. And then we have here those interproximal initial caries, but then we have this situation over here, right, between the two lower molars, okay? So of course this is recurrent caries. If you are thinking that this could be just cervical burnout, well, of course not, right? Just check the pattern of cervical burnout of this patient, okay? There are cervical burnout areas on the radiographs as usual, and this may vary from patient to patient and even from the angle that you are actually taking the radiographs, okay? So now we can see that the dentin is more radiolucent as compared to the rest of the dentin area. And take a look at this. Even the pulp chamber, the horn area here is atrophic, right? So this is also indicating the alteration for you. We have here this radiolucence ill-defined with ill-defined limits, and of course this image is suggestive and also compatible with recurrent caries, okay? Recurrent caries associated with this occlusal distal restoration over here, all right? And then we also have the situation of the mesial surface of the second molar, okay? We also have caries here. Just check the contour of the enamel, okay? So the radial opacity of the enamel is now affected in the area of the contact points, you know, as usually happens, okay? So always pay attention to the contact points area. Very good. Now let's go to the main alterations of the case at the bottom left corner of your screen, and then you guys are seeing that we have caries as well, right? So interproximal caries happening, and then especially here on the distal of the second premolar, we even have the pulp chamber is now a little bit atrophic as well, and we have periodontal ligament space widening, okay? Periodontal ligament space widening as a reaction of this situation, huge caries over here, all right? And then since the patient is usually not flossing, you know, in cases like this, we also have the recurrent caries at the mesial aspect of this metallic restoration, okay? So most likely you would remove these caries, and then even you would be able to check with direct vision, okay, to the mesial surface of this molar, all right? So you could actually do that. If you are not sure where the pain is coming from, and this is one of the upcoming cases, we're going to discuss this, then of course you also need to include something else in your clinical examination, which would come always before the radiographs. Don't forget about this, but we are going to talk about this very soon. So let's first discuss the case on the middle part of your screen, or the upper middle part of your screen, and then the pain here was actually a gingival pain. Okay, so of course you are going to realize that the gingival tissue is inflamed, you know, and then when you take the radiograph, because sometimes the pain is too much and the patient is not sure exactly where the pain is coming from, but now you have the radiographs, okay, so you have the periapical radiographs of this area, although this periapical radiograph is the best one for canine and lateral incisors, but of course we can see properly the central incisor as well here, right? And then take a look at this, we have the subgingival calculus, okay, so we have this calculus here associated to the roots, and of course one can wonder why this is happening, because we have the overhang of this metallic restoration, okay? So the root canal is treated, although a little bit underextended, but then, you know, there is a little bit of periodontal ligament space widening, but you know, just a little bit. This is not indicating periapical pathology, okay? So you would basically check that, you would follow up this root canal treatment, but then you would need to replace the crown, of course, right? Because the crown has an overhang, and that's, of course, not acceptable, okay, for the patient. And that's why you have now this calculus here. But at least you could replace this crown, and of course you need at least to try to do, you need to do the subgingival debridement of this calculus, right? So you would do root scaling and polishing, you know, so you would of course treat this situation over here as well. And then take a look at this, we have also bone loss, right? So horizontal bone loss, it would be vertical, but now the level of the alveolar crest is gone as well. So not gone, but of course the level of the alveolar crest is now, you know, resorbed, and of course because of this situation. All right. Let's now discuss then the case in here. So in the middle part, the lower middle part of your screen, and then of course you are seeing that we have a little bit more challenging situation to detect where the pain is coming from, okay? So again, we should perform clinical examination very nicely before the radiographs, and now, of course, we also need to do a vitality test and percussion test, okay? So you would need to do both of them, and then with vitality test, you would realize that the pain is coming from this molar here, okay, so the second molar, right? The pain is coming from the second molar, and then even on the radiograph you can see the radiolucent aspect here below the deeper part of this restoration, okay, and you can compare with the rest of the dentin, right? This is even reaching the area of the pulp chamber, okay, of the horn of the pulp chamber. So we have even periodontal ligament space widening, and then that's the situation. You would detect that this is the restoration that needs to be replaced. And even though the radiograph sometimes underestimates the situation, when you remove this restoration, then you would find caries, and you know, even most likely this would be going to a root canal treatment, okay? Then of course, if the pain would be coming from the root canal treated molar over here with this big restoration, of course this is a situation that we need to be careful about, but then most likely this would be a periapical pain, not a pulpal pain. So pain to percussion, tenderness to percussion, for example, okay, and you would be suspecting maybe of root fracture, you would do a CBCT. This would be, you know, indicated for a case like this if you are suspecting of root fractures, okay, and you would still assess your diagnosis properly, all right? So we have here this article. Don't forget to take a look into this article, and don't forget to look at the other cases, the other videos where we have decision-making training for you guys, okay, about caries, between caries and endo, between endo and extraction, and those are exactly for you guys to practice, okay? So if you guys like, please hit the like button, and see you guys in the next videos.